Good morning. I am pleased to be here today to discuss an issue with you that is very near and dear to my heart. This is the issue of foster care and the impact it has on the children placed in the foster care system. According to recent statistics, there are currently over 510,000 American children placed in the foster care system. This is because their families are in crisis and cannot take care of them. For these kids, being removed from their homes can be incredibly traumatic. As social workers, foster parents, or child advocates, it is easy to assume that these children view us as their heroes, rescuing them from terrible situations or deplorable living conditions. Obviously, for infants or children too young to comprehend, they know nothing different. But for many of these children who are older or may be more attached to their homes or parents, this removal can be especially difficult. Children may not understand why they are being removed or if they will ever see their parent again. We must be more sensitive to these issues and do everything in our power to make sure that removals are handled appropriately. Life in foster care is very different from what is considered the normal childhood experience we hope each child will have. Having to assimilate to the rules and routines of a household that is not your own is no easy feat. At times there may be other children in the home you must adapt to and get to know. The dynamics can be difficult to navigate, especially for older children. We know from the data collected by AFCARS, which is the Adoption and Foster Care Analysis and Reporting System, that over 40% of the children in foster care are over the age of 13. This number should make you concerned. This means that almost half of the children in foster care are preteen or teenage children who are having their lives upended, mostly because of the choices of their parent or guardian. For these older children, life in foster care can mean changing schools and getting used to new teachers and classmates. It can mean leaving behind your belongings and taking with you just the clothes on your back at the time of your removal. Most of these kids have to take what little they have from placement to placement and hope nothing gets lost in the move. On average, children will experience 3 placement changes during their duration in foster care. This can create significant attachment issues, especially in younger children. So what can be done? Well, for starters, there needs to be a push for more people to become foster parents. There has been federal legislation that has been implemented to attempt to incentivize becoming a foster parent. This sounds great in theory, but it can attract the wrong kind of individuals who then are only in it for the money. I agree that it is important to compensate foster parents accordingly because they are taking on a huge responsibility, but the support for foster parents doesn't necessarily need to be all monetary. Providing services to them as well can be invaluable. Many foster parents struggle with transportation, getting kids to doctor's visits, visitations, etc. Having a network of people who can help out by picking kids up for appointments or visits can be a big relief for foster parents. Providing access to foster parent support groups and respite providers who can offer them a break when they need it would be a huge asset as well. Next, after we secure more foster parents, then we need to focus on the training and the education they are given. Foster parents need to be adequately prepared to deal with the myriad of issues the kids they will care for come with. They need to be armed with access to doctors and therapists who can help the children and them deal with issues that may arise. Also, as social workers, being upfront and honest with foster parents about what issues the children have gone through would be helpful. Implementing support for new and existing foster parents can help to make sure that foster kids have the smoothest transition and the best experience possible while in foster care. Most importantly, making sure the kids are safe and feel comfortable can greatly reduce the number of placement changes a child will experience, which will indirectly affect the level of trauma they feel about being removed from their home. For social workers, we need to remember that while removing kids from bad situations can be an everyday thing for us, it is not an everyday thing for the children. And as hard as it may be to not become jaded, we should treat every situation as if it were happening to us or our children and handle it accordingly. Placing ourselves in the shoes of the children in foster care can help to guide our thinking. Their lives are essentially in our hands, and we should not take that lightly. By being mindful and intentional, we can help to do our part in making a bad situation just a little bit better. Thank you for your time and your continued support of this mission.